Now better, ma'am? Can you hear me?
Yes, yes.
Fine. Fine. There are so many mommies who just joined. Kavita ma'am again left. Just wait for a minute. There's a major network issue going on. Okay, it's better now. Dr. Kavita, you're able to hear me? Now the voice is clear, everything is clear. There's this major network issue going on, people. Just stay with us. Is it better now?
Nisha, we're just still facing some trouble here.
Even now the voice is not clear.
Your voice is better, but I'm not able to. Are you guys able to see me?
Yep.
I think we can go ahead.
Yeah, and there is no voice break or any.
Oh yeah, now I can easily hear you guys. Yeah.
Perfect.
Okay. Right.
So
Yeah.
taking the show, ma'am, as I was saying, being a female is not easier. With age, with stages of life, everything changes, right from our body to our issues to the doctors we are looking at. My daughter is today 11. Today I'm going to a pediatrician. And tomorrow someone comes and tells me you have to go to a gynecologist. It's a big decision as a mother. This is the one question. Second one which coming up is, I'm not pregnant. I'm not planning from pregnancy. I'm 40, but why should I go regularly for checkups to a gynecologist? There are so many such questions which comes in our life. So there are only why. There's no clear questions answered by experts. So today at Nutrizoe, we thought to get an expert who herself is a very senior gynecologist at Aster and Prime Hospital, Bangalore. She comes with an experience of 2 decades. She is a highly qualified clinician, specialized in high risk pregnancy, maternal medicines, laparoscopy, PCOS, PCOD, breast cancer, infertility, and many more. So, in short, she is a perfect person to guide us right from the puberty stage to a menopause stage. What all issues we can face and why we should consult a gynecologist. Please welcome Dr. Kavita Kovi.
Thank you, Nisha. Thank you so much for the introduction.
So,
Thank you.
before we begin, why don't you ask what is the role of a gynecologist in the life of women? So, when we take life stage, it at the adolescent stage, before marriage, pregnancy, 40 plus, 50. So what is the role that you play there?
Right. Let's start from the adolescents or the 13, 14-year-old, the teenagers, right? So generally till that time they'll be going to the pediatrician, but then they tend to get all the queries about, some of them get their periods very early, by 9, 10 years of age. Some of them get their periods at 11, 12. So they have their own queries, the irregular cycles, and they have the problems related to cycles, problems related to growth, facial hair, acne. These days kids have so many questions. So the mothers bring them along, and yes, we do sit and try to tell them why the cycles are irregular, what kind of care they are supposed to take during periods. It's very important to teach them menstrual hygiene. Not every time, they may be taught at school. Sometimes we may be the ones who are going to pitch in and tell them how to use their pads and menstrual hygiene, especially when to change and what to do about it. And the vaccination for HPV, that's something sometimes it can get missed in your regular schedule of vaccinations. So when they're about 12, we call them, we would like all the girls and the boys also to get vaccinated for HPV. So these are the kind of things which we look into. Some of them may not get their periods. Again, they do come to us to find out whether, the girls showing all the secondary sexual characters like breast development, hair, everything is there in underarms, but still she's not got her period. and she's 16. So early periods, irregular periods, putting on weight, acne, hair problem, all these issues, they do come and see us. And when they talk to us, when they understand the problem, the mothers are very comfortable, so does the child. Till that time, the child is so frustrated as to what's happening with her. She doesn't even understand what's going on. But when we do explain a little bit of science to them, they're very, very comfortable. Preconceptional age groups, why do they have to come? Nowadays, sexual activity is a little on the higher side. So we would prefer to talk about sexual health at that point of time, and how to protect yourself from sexually transmitted diseases, when to start your pap smears, and these days the questions are about what is the right age to conceive. So all these things go for those women who are going to come to us before wedding itself, or during that phase between 20 to 30s. And then at 30s, yes, they get pregnant, and they see us for a few years, 1-2 years probably, and then lactation and post-pregnancy care, they do come to us at that point of time, and regular health checks keeps going on at that point of time. 40 perimenopausal age group, their set of problems, mood swings, irregular cycles. So there are plenty of problems at that point of time as well when they come to see us. And then comes your postmenopausal or menopausal age group. Again, sleeplessness, palpitations. You have your own set of problems again at that time. Bleeding, irregular cycles. Oh yes, there's quite a bit even at that point going on. Post-menopause is all about your bones, your bone health, and then any kind of postmenopausal bleeding. These are the things which they come, then urinary problems, incontinence. So they come to see us, and then we sort these problems one by one. So we are always in the picture from the time, they are about 10 years of age probably, and there's no age limit to see a gynecologist. Right. So anything, the children can have white discharges. So we cross-references from the pediatricians quite happen in our OPDs. So it can start right from childhood till the end, right? So we keep seeing women. So there's no age limit to see a gynecologist.
Good. You mentioned, and you mentioned so many points. Just realize that half the people go and consult us. So as I did my study about life, about this topic, about all the issues that we face, apart from the ones that are very general, which to know I'm gonna be pregnant, if I'm having extreme periods, few of them which are on a very confusion side, which should I go or should I not go? So one that comes up is painful periods. Generally, mothers tend to ask or just rest for 3 days. So when should they consult during?
So yes, usually for kids, painful periods is very, very uncommon. They generally have anovulatory cycles, so they may not have painful periods, but they may have prolonged periods. But if they do have painful periods, it's better they come and seek help rather than the child curling up and lying down in the bed. Sometimes they do vomit very severely. We have some medications which can help. There's a myth, or probably I would say the mothers are very scared to give medication to the children. So there is a pain threshold for everybody. Probably somebody can take it, somebody cannot. And why should they be so uncomfortable when they're going to school or when they're going to go out with their friends? So we do try to help them. But luckily, when the formative years, when the cycles are coming in the beginning, most of them are anovulatory cycles, so they may not have much of pain at that time. If they're bleeding very heavily and if the clots are coming out, so probably they may see a lot of pain at that point, and they may see, as I said, very discomforting pain in the pelvis, vomiting sensation, they have headaches. So that's when they come to seek help. It's definitely important to come and see us at that point, so we will help them so they can see the doctor at that time.
Next one is almost close to the station side. Nowadays, some of the doctors, also some of the women after giving birth to the child, also they face a lot of.
Isha, your voice is breaking. I can't hear you at all.
Ma'am, irregular menstruation cycle.
Irregular cycles. You're talking about irregular cycles, yes. So the most commonest cause these days for irregular cycles, as I mentioned in the beginning, it will be anovulation. Your hypothalamo-pituitary-ovarian axis, the axis is not formed in the beginning. So girls having irregular cycles in teenage is very common. But the other reason for irregular cycles at that point of time is polycystic ovaries. So the main reason for this is obesity, lifestyle, not exercising, unhealthy diet. This is one of the reasons for irregular cycles at that point of time. So irregular cycles per se, if it's troubling you, please come over to see the doctor. But generally between 24 to 38 days, anytime you can get your cycles, so that's not considered irregular. If you get a 24-day cycle, that's fine. If you get a 38-day cycle, it's fine. Anytime in between, it's fine. But some women are in, when you ask them, are your cycles regular, they think that one day, the clockwork, they said that 28 has to be 28. It's nothing like that. You can get your periods anytime between 24 to 38 days. But if you have irregular cycles, that's if it's crossing 38 days, or you're getting once in 45 days, or you're just getting so irregularly, one month it's at 20, the other month it's at 35, then it's always better you seek help. So we can correct it. And 90% of the times it is either thyroid problems or polycystic ovaries, or sometimes a functional cyst in the ovary. These things we look into, and then we will be able to help you.
Ma'am, there are so many OTC products for birth control pills are available. Before taking those pills, should a man consult or a woman consult a gynecologist, or they should go and pick up?
No, I would not prefer birth control pills over the counter. Hopefully nobody is giving it these days. See, before we prescribe any birth control pill to anybody, we take a detailed family history. We need to know whether you had any history of thrombosis before. Did you have any clots in your blood? Did you have any surgeries prior? Do you have any conditions, any epilepsy, liver conditions? Is there anything, medical conditions that is associated, any family histories? We are hypertensives. We are very detailed, thorough investigation. After that, after the thorough investigation is when we give you the medications. And each medication, there are certain doses in each medication. Different kinds of hormones are available on that. Depending on it, suppose you are lactating, then we will be using a different set of medicine. If you are, a young girl, then we'll be using a different kind of estrogen dosage in that. And for certain people, little older women probably require a little higher dose of estrogen when we are using that. And as I said, when you're taking any other pills, associated pills, then I'll have to see what kind of dosage I have to prescribe. So taking birth control pills over the counter or emergency contraceptive pills just like that popping in is absolutely not a good idea. You need to see the doctor, get yourself properly checked, thoroughly checked for that matter. These pills can be very dangerous if you're just taking it over the counter.
Thank you so much. What that also got me. So during the posting negatives, there were mothers who were happy. So next one is also a very common issue. Normally, think a lot, just increase your water, take some of the OTC medicines are gonna for UTI.
I can't hear you, Nisha.
Ma'am, UTI.
Oh, urinary tract infections. Okay. So the urinary tract infections, right? See, this is the most commonest thing a woman can get. I mean, especially during summers, and working women. What I have seen mostly is in working women, they don't have, either they forget to drink enough water.
Ma'am, we cannot hear you.
So the problem is we don't drink enough water, we do not go past urine regularly, so we keep a store for a long period of time. So these are all the predisposing factors for urinary tract infections. Especially with urinary tract infections, I would expect people to first get a culture done. Just do not take the medications on your own. You are brewing bacteria inside and we don't know what kind of bugs are there inside. So you better first go see the doctor. Get a urine culture done. She'll give you a symptomatic relief for those 2 days. In the culture, we'll find out what kind of bugs are brewing inside you, what is the medication that we need to treat you with. So it's not easy. And if you keep taking over-the-counter medications, you're going to grow bugs in your body which are not going to respond to the regular simple antibiotics. You would have made a very resistant organism inside your body. Please don't do that. Kindly go in, meet a doctor, take a prescribed drug. Do not take over the counter, please.
So also a very unspoken topic, especially when it comes to India. Especially when it comes to Indian, it's something spoken. They do not talk about it even to their members, which is discovered during
Yes.
course. They don't want to discuss this.
Yeah, but fortunately enough, these days I'm seeing women coming into the OPDs and the couples coming in and discussing the issues. The first thing they look at is the doctor receptive? Is she going to, be receptive to my questions? Is she going to respond to it, or is she going to shy away from answering? This is the first thing I've seen, Nisha. They need to find a comfort zone. Probably they'll come and meet you for the first time for some other problem, but the second time when they come, they generally do open up and speak about it. So it's always better you speak to your doctor, because she can solve it for you. She will examine whether you have a problem in the vagina or whether it is vaginismus, which is just a contraction of the muscle. So she can prescribe some solutions for you. Discussing about your sexual life with your gynecologist is very important. There's nothing wrong with it. And most of the gynecologists these days are very calm, composed, and they will be able to help you out. So, it's just that we are taught to be, empathetic, and so we will be able to help you out with those things. So especially, you can have a psychological stress. These may be simple things which could be sorted in just an OPD discussion, and we have helped many women out of this. Especially vaginismus stresses have gone and they've conceived, delivered vaginally. So that's the most beautiful part of, solving these cases. So it's always better you go and speak to a gynecologist of your comfort. So no problem.
The next one that is there, nowadays people have started using tampons and many products. So before using these products,
so coming to tampons and menstrual hygiene basically is what we are talking about these days. So there are lots of women using menstrual cups, women using, pads, women using tampons. So basically when we are talking about environmental, most of us are very conscious about environment these days. So most of the women are moving towards the menstrual cups. They do come into the OPDs to ask me how to use it. That's a good thing. How to insert it, how to remove it. So menstrual cups is a different story. When it comes to tampons, I've seen in my experience forgotten tampons. That's something which is very, very scary. So when you have left the tampon inside, please remove it after 6 hours. Reuse another tampon. So leaving it inside may cause a lot of problems. I have seen patients come with foul-smelling vaginal discharges. They would have totally forgotten about the tampon which they have left inside. Sometimes you may end up with toxic shock syndrome. It is very much known that you may even end up in the ICU with a forgotten tampon inside. So, and it will cause a lot of problem for the women, and it is not safe. So please change it every 6 hourly. That's not an issue. And following menstrual hygiene is very important. The vagina cleans itself. It has a way of mechanism of cleaning itself, but it cannot push out a tampon. So the tampon has to be removed, and you can use the tampons. It's not an issue, but it has to be every 6 hours. Change the tampon and make sure that the count of tampons, how many was there in the pack and how many you've used and whether you have disposed them or not. So it is very important to follow menstrual hygiene.
so ma'am, how about the breast? At what stage women should consult a gynecologist?
Okay, so the breast development starts, at around 10 years, 2 years before you get your periods, you start seeing the breast mound. Right. So why am I bringing this up? That the children also can have problems with the breast, right? So recently in one of my OPDs, I had seen a child with a lobulated or tubular breast. That means they do not have any lobules at all inside. It's just a flabby, mass, right? It's just a tubular mass hanging around there, and the parents were very concerned, so they brought the child to the OPDs. So yes, nothing can be done about it, but at least I can assure them that the plastic surgery can be done, or tomorrow a breast can be created for it. So you can bring in the child as early as possible. If you think it is different, or if you think there is a problem, you can bring the child in for an examination. So the doctor will be easily able to identify these kind of problems. But routine examination, self-breast examination can start as early as 14, 15 years of age, but basically we say 20 plus, when you start examining your breast, especially if you're taking birth control pills regularly and, if you're on certain kind of medications, you can go to the doctor, she'll teach you how to do the breast examination, and then you can start doing it monthly once, right? And it has to be done after period, never do it during periods or just before periods. So you can do it after periods, and it is all given in the net how to stand in front of the mirror and do a self-breast examination. So it's going to be only monthly once. Please don't keep on pressing your breast, and it's really not necessary. A change in the color, change in the skin tone or texture, any itching, inverted nipples, discharge from the nipples, anything, you can come to the doctor. I generally advise a breast ultrasound. If anybody is worried, if they have a pain or anything, we do not advise mammograms very early. We just try to get a breast ultrasound. But if there is a family history which is going on, if your first degree relative, your mom, your aunt, anybody is a breast cancer patient, then we would ask them to come in early for a mammogram. But otherwise, we generally try to screen with the ultrasound. These days, ultrasounds are very good modalities of screening and imaging, and we'll be able to see everything. So it's not harmful either. So you can, every year, I generally suggest an ultrasound of the breast and an ultrasound of the pelvis and a pap smear for everybody.
Okay. So I guess it's very well explained, stage wise, beautiful manner to have made mothers understand when to start ask for help.
Yes.
Because I think as a child, so when we teach them, they know how to form. So as we grow, we should also hold hand to our seniors, experts, our doctors, even for small to small things, and not hesitate while asking questions.
Yes.
So as I'm saying questions, there are so many questions that we today from our mothers. I like to take them one by one. And first question is, at what age can I see a
At what age can I see a gynecologist? Right, as I said last time, you don't have to worry about the age. If you think you need to see the gynae, please come over and see. It's nothing. I've seen babies, I've seen, 5 to 6 years of, girls having problems. So anytime, there will be precautious puberty. Suddenly you can see, a 5-year-old or a 6-year-old suddenly showing signs of, getting into periods. So all these things, you can start seeing me from any time. The gynecologist you can visit a gynae office anytime. So there is no age limit to it.
Okay, the questions are not audible. I guess there's some from my or what.
Yes, yes, yes.
So moving on to the next question, what to expect when I visit a gyne with a 13-year-old child?
A
What
13-year-old child, why would
what
they need to come?
no,
Why
what are
would they
the
need to come to a
expectations?
gynae?
What to expect?
What to expect in a 13-year-old child's gynae visit? Okay, right.
Yes,
So,
yes.
yeah, the first thing at that point of time is her body keeps changing. So, this little girl who was, wearing everything, and, how, she would not see a change in her body, would start seeing a change in her body at that point of time. So first thing when they walk into a gynec's office, or when we are talking, probably the first thing which we look at is, for that age, has she grown well? Or does she have developed any secondary sexual characters? And she got her periods? If she has her periods, we're going to discuss, as I said, the menstrual hygiene. So we're going to look into everything. The main concern the mothers come up with is her irregular cycles, that she's developing pimples, acne, whether she's going to gain height. So there are all these questions which they come up with. So you can ask any questions you want to the gynec at that point of time. And I keep assuring them, you can gain height after you get your periods as well. So not to worry about the heights, especially many of them are worried about height. They can gain a little bit of height even after they get their periods. So it can be coming from the perspective of height to diet to menstrual hygiene. to acne and pimples and obesity, all these kinds of problems can be discussed for a 13-year-old.
Okay. So as you have already mentioned, one of the myths, the very common myth which comes up is that I have to be 21-year-old to visit a gynecologist.
You need to be 21-year-old only to get a pap smear done, but not to visit a
Not to
gynecologist.
visit a gynecologist, right?
Yes, it's better you visit a gynecologist before you are going into or you want to initiate your sexual life, so that you do understand what you're going through and what it is going to be. So there's no age limit to see a gynecologist.
Perfect. The next one is, ma'am, do kids need yearly examination?
Kids, no. We don't do any examination on kids basically. Very rarely I do ask for an ultrasound until and unless they complain of a lot of pain, whether sometimes there can be a cyst, ovarian torsions. We see quite a bit of torsions in young girls. Other than that, we generally don't ask for an ultrasound or an yearly examination for children. If they have a problem, they can walk in, but otherwise we don't ask for yearly examination for children. Anyway, they're seeing the pediatrician still there about 14 to 16.
So the next one that's coming up is, I am 30 plus and I don't need to see my gynac every year.
Yeah, so as I just mentioned, everybody goes for health checks, but they just try not doing a pap smear or an ultrasound. They just do the bloods and walk away. So, but that's not, so as women, we are blessed with extra cancers. That's what I say. We have the uterus, we have the cervix, we have the ovaries, we have the breast. So we need to be very careful. We can pick that, cancer. So very early on, we can detect them. So it's better to go for health checks every year. And when you're going for a health check, getting an ultrasound done, getting an ultrasound of the breast done, because as I said, they're only ultrasounds, they're harmless. So it's a very safe imaging modality. So a pap smear, I think I would recommend seeing a gynae every year, at least if not year on year, at least once in 2 years, so that you don't miss anything.
So do you recommend pap smear for every year?
No, see, pap smear program, we call it as a cervical screening program. So if they're sexually active, then we ask them to come in by the age of 21. So they need to see us by 21. The first pap smear probably is done roughly 21, 22 years of age. And if the first 1, 2 pap smears, the first year and the second year turn out to be fine, we may not be calling them very frequently. We will ask them to come after 2 years or 3 years. But when some of them ask for HPV DNA tests along with it, but that we generally try to do only after 30 years of age. We do not try to do HPV test very early until and unless she has some warts or something, which is very conspicuous and we can see it very clearly. Other than that, we do not do HPV testing because it is going to be positive at that point of time. We try to do it after 30 years of age. But pap smears, yes. The first 1, 2 pap smears we call regularly, and once we find that they're all fine, then once in 2 years, and then probably once in 3 years. So we can just slowly discharge them from the regular cervical screen.
Perfect. The next question that's coming up is one of the mother's question, but I guess even I'm one of them. So the question comes up is, I have to cancel my gynec appointment if I have my periods going on.
Okay, so if you've kept your pap smear for that day or the LBC, the liquid-based cytology test for that day, that's only reason when I would say please cancel your appointment, because I would not be able to take a pap smear properly. It will be blood stained. But otherwise, there's no need to cancel your appointments if you have your period. We can do an ultrasound when you're having your periods. We can do a breast examination. That should not be a problem. So visualization, if I have to see from where, if there is a bleed coming in, or if there is a polyp or a lesion, sometimes I may not be able to see properly. So I will, once I am not able to visualize, we'll be calling you back after the period. But otherwise, generally, it's a myth. You can go see your gynae anytime.
That's why I mentioned, because I also do cancel my appointments at times. Good, I got the opportunity to ask this question. The next one, that's one pap smear test also test STIs.
Okay, so when we are talking about pap smear, we are here only looking at the cells. We are not looking at anything else there. But If when you're doing a liquid-based cytology, that's a different test which we do. That time we can detect the HPV also in it. So that is one thing I said, which we follow after 30 years of age, which we do not do it very early. So when we do that, can be HPV test can be done at that time. But coming to genital herpes, that you can see visually, you will be able to find out, and the blood test can find out. And trichomonas, it is only a wet slide preparation. We will not be able to make it out with the pap smear. We may have to take a swab at that point of time from the vagina, and then we need to do a wet mount and then look at the trichomonas visually. So that is also not possible for a pap smear, but I can collect the the discharge at that point, at the same point of time. The other kind of STDs we can just visualize. For example, if there are sores or any kind of thing, then most of the STDs are by blood tests. So by blood tests, we'll find out whether there is any sexually transmitted diseases.
Right. So also help me understand, ma'am, for the vaginal bumps and vaginal odors that is there, do we need to see a gynecologist for that?
Vaginal odor, yes, sometimes, because if you have a fishy odor, it's foul smelling, you're not able to sit, it's very uncomfortable, you're pouring out discharge through the vagina, probably you have bacterial vaginosis or some kind of an infection there. So it's better you see the gynec at that point of time. Otherwise, a small change in the vaginal odor may be possible. Suppose you have not changed, you have not gone to the loo from morning, you have not gone to the toilet, or you have not changed your panty from morning, you're very sweaty. A small change will be there in the smell. Sometimes during your period, you can get a little metallic smell. Post-intercourse, you may have a little different smell, but you don't have to worry. And I see people obsessively washing their vaginal parts, which is not very healthy. As I said prior, vagina has a way of cleaning itself. You don't have to put your fingers in and clean and do stuff like that, right? So when coming to the bumps and on the vagina, so most of the times these bumps are the follicle infection. People do shave and then they end up with folliculitis. So I generally ask people to use a trimmer rather than a shaver to clean that place, because that can cause a lot of folliculitis. And the other thing which we see is Bartholin's cyst. We can even see genital herpes. Sometimes it's a simple skin disease called molluscum. So it's always better to come and see the gynec if you have a doubt, so that we examine, and if it's something that I should reassure you, then it's fine. But if there is something that I need to treat you or refer to a gynec, to a dermatologist, we'll be doing it. So, small infections coming and going, sometimes pustules coming and breaking and going, it can be folliculitis. That means that you need to, be a little more hygienic than what you are.
Right. So the next one that's coming up is, you should not tell everything to your gynaec.
Yes, actually, this is something which which I feel very funny when I'm taking my OPD. So the first few words will be like very few things will come out of their mouth, and as they find the comfort zone with me, then they start rolling out everything, and then the husband will be prodding the wife and saying, no, you missed this point. So that's when they come out. So nobody is going to judge you. It's always better to tell everything to the gynecologist, so that there may be a smallest of things, smallest of concern, but probably there may be something out of it which I can help you out with. So it's always better you tell everything to your gynecologist. So there's nothing wrong, and we are not going to share. Patient details are very confidential, and we'll not be sharing it with anybody.
So, any which way, is a very famous phrase that we always say, that you should not hide anything from your lawyer and your doctor.
Exactly.
Right. So the next one that's coming up is, don't need to see my gynaec once I'm past childbearing age.
Yes, this is where we all go wrong. Once we finish, once we deliver a baby and we're busy with children and our world changes upside down, we're all the time running behind them. We've just totally forgotten about ourselves. And then, you end up having a cyst or things which could have been taken care very early. So please visit your gynecs. As I said, the most important things which you have to rule out at that point of time is cancers. So we are more worried about that. Rest of the things we can sort it out. So regular health checks is a compulsion. And when you're doing your regular health checks, please include a gynec consult into it, especially a pap smear, an ultrasound of the pelvis, and an ultrasound of the breast. I'm very particular about telling every mother, or educating every mother rather, whoever comes in post deliveries, when they're when they finish their delivery, when they're going back, especially when it's the second child, they just totally forget. So when we keep reminding them, yes, they do come back and then get their tests done. It's always better to get your test done, safe than sorry.
Right. It's always better to be early than late.
Yes, yes.
The next one that's coming up is a mother is saying it's just a yeast infection, so you can just call for a prescription. There's no need to go to a gynae.
Okay. So sometimes we do prescribe online for yeast infections, but some of them are very resistant. And I have to tell you, recently, the simple medications have not been working, and I've been taking swabs and finding out that we may have to need a higher, antibiotic or antifungal for the yeast infections. So I have no clue as to why this is changing. Probably the lifestyle, or the fungus is becoming much stronger. The simple medications used to take care of it. But nowadays, when I take a swab, when it's not going away with a simple medication, when I take a swab and send it for culture, I'm seeing the fungus being resistant to the simple medications which we used to use, and now they've gone to a next level now. So we are using a higher antifungal. It is, I don't think that's a good thing at all. Probably, it is because of the hygiene, as I said, and the second thing, because of increase in the polycystic ovaries, diabetes picture, eating junk, not taking care of ourselves well. So it's always better that you get it checked. So first time, probably yes, the gynec may examine and write it and give. The next time, please don't follow the same medications, and you need to just come and get yourself checked. And especially if you're a diabetic, that indicates that your sugars are going high. She may even tell you what to do.
Right. So the next one coming up is, I'm healthy and I'm active at 45. Why do I need to see a gynec checkup?
Okay. So at 45, again, you're in perimenopausal age group. Okay. So here we need to tell you about your bones, what's happening, what's going to happen to your bones. And again, we need to caution you about your exercise, your diet, and your health checks, the scans, as I said before itself. So pap smear, still pap smear values at that point of time as well, an ultrasound of the pelvis and an ultrasound of the breast. So examination is compulsory at that point of time as well. So if we don't find anything at 45, then probably we'll ask you to come at 47. But just because you're 45 doesn't mean that you don't have to see the gynae. You will have to see it during your perimenopausal age groups as well.
The biggest myth which just came up is, if I am a virgin, I don't have to see a gynae.
Yes. So if you don't have a problem, I don't know what to say. So, but as I said, if you are a virgin, before, anybody before initiating sex, I would always ask them to come and speak to a doctor, because no better person than a gynecologist to explain things to you or tell you to be, how safe you have to be when you're getting into it, and what are the difficulties you can get into it when you're starting your intercourse. But if internal examinations we may not be able to do, even if you have some problems, probably we'll be looking at scans from above, ultrasounds from above. So you can come and see a gynec even at that time.
Right. So I think it's for ask the audience.
Again, your voice is breaking, Nisha.
Is it better now?
Yes, yes.
So any of the mothers who joined us, if you want to ask anything to Dr. Kavita, you all can just put your questions in the comment box and we can take it up for you. So ma'am, last question from my end is that painful intercourse is part of our life and nothing could be done for that.
So as I said, when we were discussing about sexual lives, painful I've seen couples for 5 years, 6 years not having intercourse because it's very painful for the the lady. So there can be a small hymenal, tight hymenal ring, which we can release it, and then she'll be very comfortable. And it can be vaginismus. We can talk to her. It can be an infection. It can be a dry vagina, for which we can be giving her a lubricant. So we can help her out in many ways. Probably she's stressed and physical exhaustion, mental stress. Anything can be sorted when you come to the doctor. If you just if you don't see the doctor, then there's nothing we can do about it.
Right.
So we can solve certain problems. And sometimes when you're having a deep pain in the pelvis, when you're having intercourse, or it can even tell us whether we can go for an ultrasound to see whether you have endometriosis or any kind of fibroids inside, infection in the abdomen. Sometimes patients come post intercourse with a little bit of bleeding. There can be a lesion on the cervix. So any difficulty faced during at the sexual life or sexual activity, you can come back and speak to a gynecologist. So we are always open.
You just got a question from Gayatri. She's saying, my baby's 4 months. I didn't got my menses after my delivery. Is it normal?
Yes. So when you're breastfeeding, especially when you're sitting up in the night and feeding, you may not be ovulating, right? So you may not get your periods. So, but I would still suggest that please use contraception, even at that, a barrier contraception, for example. You can go and get your properties done, or you can ask your husband to use the condom, but be very cautious, because you can conceive once again. So if you're doubtful and that you've not used a contraception properly, check your pregnancy test. Otherwise, I would not be worried. We can wait for the periods, even for a year.
So knowingly or unknowingly, ma'am, you're just bursting so many myths. I have taken this up earlier also, that mothers feel that if they are breastfeeding, they will not conceive. So that's a myth.
Yes. Any questions? Any other questions?
So no more questions. I think we are on the end of our show. Thank you so much for your time. Thank you so much for guiding all of us right from puberty to menopause stage. We should go consult, ask questions. At least we can always go to our gynac and take a guidance.
Yeah.
Right. And everything can be sorted there.
Thank you.
Thank you so much, ma'am.
So much. Thank you for having me. Thank you so much.
Pleasure is all mine. Thank you so much. Thank you, mommies.